This is all about language, a series by the Early Years Project. In this video, we will be talking about language developmental milestones and what we would expect for each age. As a disclaimer, before we get started, milestones and their expectations can vary among medical professionals, school systems, early educators. So it is very important to utilize the milestone expectations that are most relevant for you and the community or organization that you work with. So now let's talk about some milestones. So, language milestones from 0 to 12 months. Specifically, let's talk about that first area from birth to 9 months. We want to hear a baby making sounds other than crying. So, this can be cooing. And then within those first 9 months, they start making sounds like ma, 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 or ba, 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 ba. From 9 to 12 months, a child might start calling their parents mama and dada or any other special name. So it doesn't have to be mama, dada, but we want to see them calling parents by a specific name that they have for them. And then this last bullet point, they understand no. So that doesn't mean that they always follow the direction of you telling them no. But if you say no and they pause briefly when you say it, and then they keep going, that's the choice that they're not listening. But they still understand what the word no means. From 1 to 2 years, they may try to say one or two words. They won't be perfect. So we may hear ba for ball or da for dog. They're pointing to objects when you name it. They follow directions. They may try to say three or more words at this time, and they're following one-step directions without any gestures. From 1 to 2 years, they can say about 50 words. Like I said in the introduction to this video, and this time they're really still absorbing everything, which we'll talk about language which rich environments in the next video in this series. But they may point to objects in a book when you're reading. They say at least two words together. They're using more gestures than waving and pointing. They may be blowing a kiss or nodding or shaking their head no. From 2 to 3 years, this is really when we see that huge language growth, especially what they're using. So that expressive language. Um, they may say two or more words together with an action word. So I run, you run. They use words like I, me, and we. They are following multiple step directions. They ask who, what, where, why. They're asking all kinds of questions to learn about the environment that they're in. And they also ask for more information to understand more. From 3 to 4 years, they say sentences with four or more words. They say some words of a song, story, or nursery rhyme. They answer simple questions. And some examples that they could be saying around this time is I love to color. I color with a crayon. Mom is picking me up today. From 4 to 5 years, they love to tell stories. They can follow three or more step directions or complex directions. They're still asking questions to learn more about their environment, and they are starting to understand time concepts. So, words like today, yesterday, and tomorrow. And then from 4 to 5 years, we really want them to start labeling letters and numbers. From 5 to 6 years. So now around this time, they're in kindergarten, completing kindergarten towards that 6 years. So at this point, they're following multiple step unrelated directions. They are following simple conversations. They're able to take more than a few turns in a conversation, and they're playing cooperatively with others. The primary sources for these milestones was the American Speech Hearing Association, which is the national organization for speech language pathologists as well as audiologists. A lot of these milestones came from ASHA as well as Centers for Disease Control and Prevention. And like I said at the beginning, every milestone, developmental milestone expectation list or checklist varies a little bit. So we really tried to compile multiple things, trying to get the most accurate from each of the lists. So let's talk a little bit about risk factors for delays. So, a delay is identified through observation, assessment, and comparison to typical developmental norms for a child's age. That is a mouthful. So, really, what we're looking at is we want a medical professional or a speech language pathologist to identify delays. So, they will do observations, they'll do evaluations, and then they will compare what they're seeing a child present to the typically developing norms that we just kind of went through. We went through them very briefly. So, some risk factors that may lead to language delays include a family history of language delays or disorders, premature birth, low birth weight, hearing loss, autism, cognitive disabilities, genetic disorders, fetal alcohol syndrome disorder, stroke, tumors, cerebral palsy, poor nutrition, or failure to thrive. So, some potential signs of delay by 10 to 12 months, they are not calling a parent by a special name or demonstrating understanding of no. From 16 to 18 months, they are not trying to say three or more words together, and they're not following single step directions without any gestures. And from 31 to 36 months, they are not asking a variety of questions. They're not saying four or more words together, and they're not participating in nursery rhymes, which leads us to referrals. Okay, so we've talked about the developmental milestones, we've talked about risk factors, we've talked about potential signs of delay. So you may have a child in mind that you're thinking, "Oh no, like what if they have a language delay?" So, referrals, what can we do about that? So, with referrals, it's important to note there are multiple ways to get a child the help and assistance that they need in this area. So, you could go to your primary care physician or a pediatrician, which they will look at what a child is demonstrating, the skills that a child is demonstrating, and they can make a referral to early intervention. It's important to note that parents and caregivers can also refer to early intervention. So, in the second box on the right, we have a link here, and this is for the state of Illinois, but each state has a program for their own site or a site for their own program. And when you go on to the site, you can find early intervention services in your area. You can also find applications. And then the last area that you can explore as far as referrals is the Department of Health and Human Services. So if you Google Department of Health and Human Services for your state, you can find like a Head Start program or early education program. You will have to enter your zip code and then it will populate programs near you. So that concludes this portion of the language series. As a reminder, the Early Years Project is funded by Illinois EDI in collaboration with Illinois Hands and Voices Guide by Your Side. We invite you to get your smartphone out, your camera, and scan these QR codes, which will take you to a website with a survey that you can complete to provide us with your feedback so we can continue to upgrade and edit and change any of this educational resource for parents and caregivers. Thank you.